talking about Botox. Botox is that procedure that everybody wants to know about, but they don't know who else is doing it. For all you know, your next door neighbor is probably doing Botox as well. So let's get into what Botox is. Botox is actually nothing but a trade name of a product called botulinum toxin A. What botulinum toxin does is it relaxes muscles. So when we use it to treat wrinkles, what it's doing is it is relaxing those small muscles that are present right under the surface of your skin that overly contract when you emote, resulting in the formation of wrinkles. For example, these lines here, crow's feet, forehead lines, those frown lines that you have, all of those can be relaxed using Botox. What I'd like you to know about wrinkles is that there are two different types of wrinkles. There are dynamic lines and there are static lines. Dynamic lines are the ones that develop only when you emote. So only when you frown, you'll get forehead lines. Only when you smile, you'll get these crow's feet lines here. The problem with dynamic lines is that you're not going to stop emoting through the course of your life. And as you continue to smile and frown throughout your life, over time, over the years, those lines become static. And they become static sooner than you would expect. So you would start to get these permanent lines on your forehead or these permanent crow's feet lines at the corner of your eyes, which not everyone necessarily may be comfortable with. So if you want to prevent these dynamic lines from becoming static, what you need to do is to start doing Botox at a slightly younger age when your dynamic lines become prominent itself. So what people believe is that Botox is meant for really old people, but honestly it's not. It's meant for people, young people who are now starting to show signs of aging, so you can prevent it from progressing faster. What Botox can be used for ranges from wrinkles all over your face firstly. For example, these forehead lines that occur when you maybe look surprised, these frown lines when you're angry, these crow's feet that come when you smile, these bunny's lines that sometimes come when you smile, an upturned upper lip resulting in a very gummy smile can be tackled with doing Botox here. You can use Botox to slim your face down. So for people who have a very square jaw because of a hypertrophy of this muscle here, the masseter, we inject Botox into this muscle, making your face more oval from more round. So it can be used for facial slimming as well. Other than these cosmetic indications, we also use Botox for a lot of medical indications. For example, we use it to treat muscle spasms, which happen in spastic paralysis. We use it to treat migraines. We use it to treat excess sweating on your palms or in your underarms. So Botox can actually be used for a whole lot of medical indications as well, and it's not just a cosmetic product. The effects of Botox last from roughly 4 to 6 months, after which you may or may not want to repeat it. However, if you've done Botox once, you'd probably want to get it done again because you just like the look so much. But a lot of people ask me whether, once you do Botox, would it sort of give rise to a need to do Botox again? Absolutely not. Your skin will just go back to the previous state that it was in. It's not going to cause any lasting damage to your skin at all. It doesn't cause pigmentation. There's no such thing about Botox being used only in oily skin or in dry skin. It can be used in any kind of skin. In terms of side effects, what I'd like to say is, yes, Botox can have side effects if it's not done properly. So make sure you always go to a qualified dermatologist at a legitimate clinic so you know that you're in safe hands. The side effects of Botox happen when the injector who's doing the procedure for you doesn't understand facial anatomy well enough and doesn't know where to inject, how much to inject. So it's very important to go to a qualified person. A lot of people believe that Botox makes you completely expressionless and it makes you like a mask-like face. But that again is a very big myth. Botox, when done well, is always minimally done. You have to keep a few facial lines to let people know that you are still smiling. So you do need some facial lines. It's just the extra wrinkles that we try to get rid of. A good Botox is when no one can tell that you've gotten Botox done. So don't worry about having an expressionless face. That will definitely not happen when you do it with a qualified, experienced dermatologist. So So if you're now getting Botox done, what should you expect from the procedure? Typically, before the procedure, you don't really have any precautions as such to take. We call you 1 hour before we do the Botox, so we can apply a numbing cream. This cream numbs the skin that we're going to inject into, making the procedure effectively painless. The procedure takes hardly about 15 minutes or so, when we'd be injecting rationed amounts of Botox into different areas of the face, depending on what your dermatologist decides for you. This procedure is not at all painful. What you need to do post-procedure is to avoid heavy exercising, avoid massaging your face or rubbing it too vigorously, stay upright for about 4 hours, avoid green tea and avoid vitamin E. These are most of the precautions that you would have to take post-procedure, and you're absolutely good to go. If you have any more doubts, feel free to ask me in the comments below.